Hi, everyone. Welcome to Peds Unplugged. My name is Dr. Andy Koehler. I'm one of the pediatricians here at Northwest Arkansas Pediatric Clinic. I am joined by two of my fabulous partners.
I'm Dr. Randall.
Dr. Benafield.
Today, we're here to talk about pediatric well checks. And what I want to do today is kind of provide some behind the scenes, down to earth answers to some questions that we get really frequently here at the clinic to provide some good, concise, and hopefully usable information for you. Laureen, you are stuck with taking care of my two kids. Henry is 9, Mary Caroline is 6. This next year, they don't need any shots. They don't do school physicals yet. Why am I even bothering to bring them in?
Well, I think part of doing a physical is really, hopefully in theory, following children throughout their life. So knowing them from birth to college or through college and being able to sort of track their progress in this world. We're looking at them sort of big picture, like how are they growing? How are they developing? Like we're looking at them physically, like their hearts and their lungs, their height, their weight, their blood pressure, but we're also looking at emotional well-being, social well-being, and I feel like it's just an important part of taking care of a child. And in a well check, that gives us a chance to really know who the child is.
And obviously it changes with ages, but what are some of the things that you really like to kind of hit on with family?
I'm always kind of hitting on sleep, nutrition, exercise, kind of mood and emotional well-being in school, or making sure that kids have a good support system, so friends, family. For a majority of kids that are healthy, a lot of times a well check, it may seem like we're not really doing much, but kind of like taking your car in to get regular oil changes. It's sort of making sure that we don't miss something.
If you never come in outside of those sick checks, we just don't get a chance to actually ask those questions.
So I always tell parents, it's a process, it's progress. And so we're really looking at the whole child. We don't expect a child to meet every developmental milestone. That's not what we're looking for. We're looking at progress, we're looking for patterns. And so it's not meant to be, we're not trying to grade your parenting or grade your child and point out things that are going wrong. We're just sort of trying to track the child. And if there is something, like if there is a speech delay or if there is sort of a fine motor delay, we're watching it so that if it exists, we can diagnose it earlier, we can correct it. Therapy is so effective at younger ages. So we're looking for small things, we're following them, and if it is a problem, then we're going to address it.
So I'm going to take a quick plug real quick for the CDC Milestone Tracker app. It is really excellent, it's free, and it's a great way for you as a parent to see about where your kid is. And it really is, the design of the app is to come in and say, hey, we didn't notice or we're not quite there yet, and allow to kind of start a conversation. Because sometimes as a parent, you can feel like, I don't even know what my kid's supposed to be doing at this point. So, just a thing to look up. It's really easy. Just go in the App Store and look for the CDC Milestone Tracker. You just walked in the room and you just spent 5 minutes talking to my kid about their best friend at school, who their teacher is, and what they like to play with, and how, what their favorite episode of Paw Patrol is. Why do you do that? Is that why you're always so late when you come to my room?
For one, part of it is building a relationship and building trust with the patients. A 2-year-old or a 3-year-old is going to be much more likely to let me look in their ears and their mouth and, do an exam if they've established that we're friends, we're friendly. But also it's a chance, especially in the younger ones, I can assess their speech. And how they're doing socially. So I guess that is one.
Yeah.
Trying to get to know their kids.
Yeah, absolutely. As we get into the preteens and teenagers, obviously we're going to have different questions like that. But what's the point?
Well, I would hope, ideally, I'd have been seeing this child throughout their life, so that I remember when they loved Paw Patrol, but now they like Taylor Swift. The whole idea is that we've known them for a long time and we're sort of tracking their interests and seeing how they're doing in this world. And so it's ongoing. And so when a child comes in at 15 and they're having some depression or anxiety, I've known them. And I remember what they were like when they were 2 and 3 and 4. And I can look back and say, who their friends were, what they liked to eat. And it helps to remember the child so that when they're older and if there are issues, not always, then we know that and we're equipped to sort of deal with that. But if we don't have that relationship, how are we ever going to get them to talk to us about life? Particularly in the teenage years when life gets a little bit harder.
Yes.
So we're hoping that we have enough of a relationship that they would feel safe and know that we're a safe place to talk.
We came in and all of a sudden you're doing a bunch of stuff. I don't understand it. So tell me, why did you poke my 9-month-old's toe?
We do that to screen for anemia.
I mean, our baby's really anemic.
Yes,
They are,
they
absolutely.
are. And it's great to catch it early so that we can address it before we start to really see signs of it.
I mean, but my 10-year-old's coming in and you're going to poke him and check his cholesterol?
Sure are.
I mean, 10-year-olds do not.
Well, what we're screening for are familial conditions that cause high cholesterol. Really, what we're looking for is, unbeknownst to you, you may not know this, but your family has a condition where you have high cholesterol at young ages, and we're going to find those children, and they're going to be treated.
Whenever I go to my doctor, I get labs every time. Why are we not doing labs every single visit we do?
Because it's low yield in children, and they would not be happy. So, if you've ever had a 3-year-old's blood drawn, a 4-year-old, you would understand. We do it as pediatricians. We are really careful about what tests we do. We don't just order tests on anyone, because when I think, okay, I need to do some blood work and X-ray, I know that child's going to be upset by this. It's not going to be an easy process, and so I have to be really sure that this test is necessary.
And one of the things I always like to tell my families is, I don't want to do a test if I'm not going to.
Exactly.
You know, just doing a swab to do a swab sake, or doing a test just because. I mean, I'm just adding cost. I'm adding discomfort.
Yeah.
Oh
yeah.
Why?
Yeah.
Why do something unless it actually is going to actively help the patient? Kids are not little adults.
No, that's right.
They have their own things. That said, something I am kind of passionate about that I want you to talk about is vision screening, because this has been very important for my family.
We got new vision screeners in our clinic. They can help identify some of those alignment issues where maybe the lens isn't shaped quite right, or the eyes don't quite line up correctly. And it's stuff that we want to catch early.
So what are we doing vision screening? When I come in, at what ages do I know?
We're doing it 1, 2, 3. Once a child can do a chart, like once they can do like a letter chart then that's an appropriate substitution. But before a child can really do that, we're doing those.
I've got my teenager here, and y'all had me fill out a questionnaire about their mental health. And you just asked my child if they were having suicidal thoughts. Why did you put that in their head?
I think it's really important to ask those questions, even though they maybe are uncomfortable. Because a lot of times that's not something that teenagers are just going to offer up on their own. Or maybe they're only going to tell someone if they're directly asked. And a lot of times I've found that parents have been really surprised to find out that their teenager is having suicidal thoughts and they had no idea. I think there's a lot of risk in not asking those questions.
I think that asking a child about whether they have suicidal thoughts is not going to suggest to them to commit suicide. It's not going to increase their likelihood of committing suicide. It's not, asking about it is not going to put ideas in their head. And even in my own children, I think a lot of us had teenagers during COVID. Those children, those teenagers had a lot of depression, a lot of anxiety. And so I think for all of us, if the child is allowed to fill it out, sometimes we can get some information and then we can act. We have great mental health providers in Northwest Arkansas. We have amazing counselors, psychiatrists. We have so much available here to help if the child needs that.
For a lot of kids, it's a lot easier sort of to write it and fill it, write something out on a sheet than necessarily have the courage to talk about it.
Right.
And then it kind of gives us a place to start a conversation.
That's the point of trying to see the same person and spending the time.
Right.
So that they will actually hopefully feel comfortable, giving us those answers too. Are you really going to talk to my kids here in a couple of years about sex and puberty and all that kind of stuff?
Yes, I am. Because I want children to know who reliable sources of information are. And our children are going to learn about these things at school. And either we set the precedent that it is your parents and your pediatrician that are going to give you the correct information, or we're going to rely on TikTok and Instagram and your friends at school. And so I just think we're establishing the precedent of where reliable information comes from. And as a parent and as a pediatrician, we can relay that information in a developmentally appropriate way that takes some of the mystery out of it and takes some of the stress out of it. Yes, I'm going to have that conversation.
How do you segue into with a family?
Yeah, I'll sometimes say, you're at an age or it's time for us to start talking about some of those uncomfortable and embarrassing subjects, and don't ask these questions to kind of pry into your personal life, but more than anything, I just want to know that you feel like you can ask your parents or any of us when you start talking about sex.
A lot of times when I'm having these talks, I like to actually use this as an opportunity to cheerlead for parents too, to say, hey, it's time, you can do this, all this, but then also use that as a segue to the child to say, hey, believe it or not, your parent might know a few things about this stuff. They made it to functional adulthood in theory, and they want you to. Mm-hmm. And so I really think it's important because if we don't kind of bring those conversations, then it's hard to take that step with your kids. I know I've got them do it here very soon, and we've started a little bit, but it's sometimes it's good to have someone be there to say, all right, it's time. One of the things a lot of times I like to do before my family is to say, okay, this is not a one-time talk. So maybe you start with some easy stuff, kind of hit some singles. We can talk about good decision-making. And then as we get comfortable talking to our kids about real stuff, then we can get into some of that, stuff that may be a little bit more challenging for some people to talk to. And so, talking to our kids is a life skill as much as anything else in parenting, and you got to practice that too. Your clinic makes everyone get vaccinated. Why do you do that? And is it really that important?
Yeah, definitely. We just have seen over time how important vaccines have been to prevent so many incredible illnesses that used to cause so much pain and disease, and so a lot of times parents don't see the point anymore because no one gets polio and no one gets hepatitis B anymore.
For us, a lot of times the vaccines are a victim of their own success. But you're serious about this. You're serious that we got to get the vaccines.
Well, I am serious about it. We know that parents are making the best decision they can, so we don't doubt that. But when a parent decides for whatever reason not to vaccinate a child, we really have to sort of, in those cases, we cannot continue to take care of the child. Sort of why we came to that, and the reason why we do that is we have children that are immune compromised. So I have patients that have had liver transplants, kidney transplants, heart transplants, currently patients with leukemia, and we just cannot have them in the waiting room potentially being exposed to vaccine preventable diseases. But our clinic has that policy really to protect our patients who cannot be vaccinated or who are not going to respond to vaccines.
And I think it just speaks to the fact that this is a passion thing for us. Yeah. I've said it many times, the most important thing I do every day is I make sure that kids get vaccinated. Right. Because nothing in pediatrics has done more to improve outcomes for children than vaccines, and they are as safe as they've ever been. Yes. And we have plenty of safety studies to back that up. So I want to end with just kind of a plea to families that just want you to know it is okay to show up at your well check with a giant list of questions. It's okay. I love it when families show up and they've got the Notepad app open and they've got their list.
That's what we do.
Because that's one of the points of these visits is to make sure that your concerns are getting answered. There is no question that you can ask that we haven't heard a crazier one. It's okay. We're fine. Yeah, don't ever feel bad about it because that's why we're here. And we want to be assets for you and your family. And I want to thank y'all both for coming out and talking with me. And thank everybody for watching. We encourage a child to get a well check every year after they turn 2. So if your child's been a while since they've come and seen us, please call in and let's get you scheduled.